We had gone in for his 3-year checkup, and they tested his iron level as a normal part of being, doing his 3-year-old checkup. And it was low, so nothing we haven't dealt with before. We had to give him supplementation for that to bring up his iron level. A month later, my husband brought him into the pediatrician to be rechecked.
October 6th, still remember that day. It was the hardest day, and I still remember when they called us 11:30 in the morning. We were just getting home from Children's when the doctor called me, told me that I need to get a hold of my wife and come and see her as soon as possible. I called her and she wanted to know what was going on. I don't know, all they said is they want to see us, but she knew what was going on.
So we got to the pediatrician's office, waiting a little bit. I would say maybe 10 minutes. It felt like hours. And the pediatrician walked in the office, and we had a close bond, I would say, with her. Been with Manny since he was born. I remember looking at her, bawling, saying, "Just tell me, I know he has cancer. Is that what it is?" And then she started crying with us and said, "Yes, it's what it is. I've already talked to the oncologist at Children's. They're setting up a room for you. When we're done here, we're going to need you to go home, pack some bags, and go to the hospital and be admitted."
My older son, Ricardo, he was so scared that I still remember he asked me if Manny's going to die. I mean, what can you tell your other son, We don't have the answers. Nobody does. But now they're very close together, Manny and Ricardo. I can just say they are like twins, even if they're big difference in age.
It was not an easy road right away. Even though I was a nurse and I should know about these things, it was a whole new world for me. And now it's a little bit more personal. It's not just me caring for someone else's loved ones, it's caring for my own, and trying to keep myself healthy, to take care of him, and also try to be a support to the rest of the family as well. I can't imagine having gone through this without every individual that has come across our path through the MAC Fund. From the CNAs to the nurses to the doctors, everybody has played such an important role. And without their support, he wouldn't be as confident as he is and was at the point while he was going through treatment. They made him feel comfortable every step of the way. He had his normal anxieties that any other kid would have, despite his confidence. However, there was those moments where he didn't want his port accessed, or he didn't want to go through 8 hours of being in the clinic. But Child Life would get involved, the nurse practitioners would get involved. They would try to find anything they could to make the process less painful for not just him, but for us as well.